Good evening, everyone, and welcome to the Valley Stream 30 Community Forum on COVID testing. I'm happy that we are able to have an opportunity this evening to discuss with all of you our plans for testing in Valley Stream 30 if and when we are designated either a yellow, red, or orange zone. As you are aware, there has been an executive order put forth by the governor's office that speaks to the fact that testing is required in school districts if designated yellow, orange, or red. We are currently in the process of planning and preparing for that situation if it occurs in Valley Stream 30. This evening, I have some of our administrators in our district, as well as representatives from an organization we plan on partnering with. So let me first introduce who we have with us this evening. Representing the Forest Road School, Erin Malone, Principal.
Good evening.
Representing Shaw Avenue School, Christopher Colarossi, Principal.
Good evening, everyone.
Representing the Clearstream Avenue School, Principal John Singleton.
Good evening. Thank you for attending.
And representing ATC organization, the Regional Director, Panina Wiener.
Hi, good evening. Thanks for having me.
And we have on board with us also our Assistant Superintendent for Curriculum and Instruction, Jennifer Luner, who will be facilitating questions this evening.
Good evening, everyone. If anyone has questions this evening, I ask that you email your questions to covidtesting@vs30.org.
Can you repeat that again, Ms. Luner?
Sure, I'm going to put the email address up as well, just so everyone has a chance to see it. The email address for questions is covidtesting@vs30.org. So here it is. You want to just take a quick picture of it or write it down. So if you have any questions that come up in our next short presentation.
Thank you. So as I began to share with all of you, our plan is that if we become a designated zone, most likely yellow, we would have a plan in place where we would be able to provide testing at our schools. The amount of testing that is required by the executive order is 20% if we are in the yellow zone. So that's 20% of our students and staff combined. This evening, I'm going to introduce Ms. Wiener, who is going to share a little bit about who ATC is and the process that will unfold based on our partnership with her. So I'm going to turn the floor over to you, Ms. Wiener.
Okay, hi everyone. Thanks again for having me. So ATC Healthcare is a national staffing company. We're a medical staffing company, been around for 30 years. And when COVID happened, we realized that there was going to be a tremendous need for testing. And since we have staff all over the country, we decided we would jump in and see if we can ease this burden a little bit. Being that I live on Long Island, we've decided to really help out the Long Island school districts specifically. We're working with all sorts of businesses and production all over the country, but with schools specifically, we're here for Long Island because that's where we live. So when we come in, we set up a testing site. We bring down lots of staff. We bring down administrative staff and technical staff for training. Everybody who comes is trained in a pediatric technique, which is very, very limited invasiveness. It only goes a little bit in the nose, swirls 5 seconds, and then to the other side. It's not the brain test like other people had talked about in the past. We come in, everybody is friendly and sweet. We try to make it a very upbeat environment. We come in, we do the testing. Everybody will have gotten paperwork in advance. On that paperwork that your child will bring with you will be just a little bit about your demographics, the child's name, address, date of birth, that kind of stuff, and also a place for medical insurance. As long as the child has either active medical insurance or a social security number, there is no out-of-pocket cost to you and to the school district. When we come down, we're gonna do a COVID test that looks something like this. I'm gonna just, Amelia, gonna just see if I can grab one of my children. I'll actually do a COVID test on them to show you exactly what it looks like. Okay, Amelia, come right on here on the camera. Hold on, I'm gonna adjust. This is Amelia. Amelia, this is your big moment. Amelia, would you like a COVID test?
Yeah.
Yes, she's my model. So we would open up the COVID test for all of your children. We'll be wearing gloves and a gown and PPE, but since Amelia lives with me, I got her. So it has a tube that looks like this and a stick that looks like this. Do not be frightened. Most of this does not go in your child's nose. So we would ask your child to tilt their head back a little bit, and we would just insert the stick a little bit, swirl 5 seconds, and take it out. Amelia, how was that?
Good.
Good. You want another side?
Mhm.
Yeah, okay. And then we would go again, 5 seconds, and we're done. How was that, Amelia? Look right in the camera, tell them all. Was it hard?
Good.
Did it hurt?
No.
No. Okay, dismissed. You know, I'm gonna throw it out. I got it. Thank you. Okay. Anyway, that's the process. We have lollipops if parents are with them and the parents give permission. If the school wants, I know because of allergies, we don't always give out lollipops. At the end of the testing, all the results will be sent directly to the school, and the school will be contacting the parents if there are any positives. Any other questions that I didn't address?
Ms. Wiener, have you had an opportunity yet to work in any other school districts on Long Island at this point?
Yeah, so we've worked with a lot of private schools starting all the way back in August when they were deciding whether to open school or not. We did lots of testing sites for those. We've been doing some charter schools in the city also. But most recently, we started with the Great Neck School District and the Massapequa School District, and we did their testing this week. It went great.
Wonderful. Okay, so that's a quick overview of ATC, which is around the clock
Right.
healthcare, and we're going to ask Ms. Lunar if you can lead us off with some questions that have been submitted by parents, so that our group can share some answers.
Sure. So our first question this evening is, if my child is not tested, will he or she be allowed to attend school?
Good question, and an important one to understand that in Valley Stream 30, if your child is not tested, they will be able to still come to school. This whole process is voluntary with the goal of getting to 20% of our staff and students combined.
Our next question is, do I have to accompany my child for testing?
Any of the principals?
You do not, hi, it's Ms. Malone. You do not have to accompany your child for testing. That would take place in our building, so your child is comfortable. However, should you choose to accompany your child, we will definitely make accommodations for that.
Thank you, Ms. Malone.
What happens if you do not get 20% of staff and students to test?
Okay, I believe that we will get the 20%. We are going to work towards that. The whole reason why we're asking families right now to complete the survey is for us to get a sense of who would be willing so that we can be able to roll out our plan as quickly as possible. If we don't get the 20% over a 2-week period, then based on the executive order, we most likely would have to close school and go to a remote instruction.
If your child was tested for COVID-19 prior to the testing at Valley Stream 30, will your child be subjected to another test?
I'll take this one also. No one, again, I have to reiterate, no one is being subjected to anything. This is voluntary. If you've already been tested, that's fine. But again, the whole idea behind the testing in schools is within a certain period of time. So if we become a yellow zone, everyone becomes eligible to be tested, but it's not required for you to actually test. And if you've already tested before, you could test again.
Our next question is, how accurate is the testing?
Okay, I guess this one's for me. So we do the PCR test, which is the gold standard of testing. As far as tests are concerned, there is no perfect test yet. COVID's pretty new, and so I think everyone's just doing the best they can. But this is the best test that there possibly is. We only work with national labs like Quest, AccuReference, BioReference, Genesis, LabCorp, and so we only work with nationally recognized labs to do the best test that there is out there. So you can feel confident in its accuracy.
Thank you.
Will visitors be walking through the buildings on testing days?
So all of our principals have been asked by Dr. Sterling to identify an area in the building that would be most convenient for people to be coming into the building. So I would speak for Forest Road. We would be using a kindergarten room that is not in use right now, where we would be able to use an exterior exit. We would also be assigning somebody from the building to be in the room at the same time to monitor the flow of traffic. Mr. Colorasi and Mr. Singleton, do you want to talk about your identified rooms?
Well, I would just add to that, Ms. Malone, all visitors, of course, would be screened and answer our survey upon entering the building. But yes, very similar to Forest Road, Shore Avenue would have a vacant room that is close to an exit entrance.
And as for Clearstream, we have a room that is located right next to our nurses' room, which we've identified as that room that we will have the testing in. And the flow of traffic will come from an outside door directly to that room and then back outside.
Thank you.
Are there any hidden costs?
Nope. As long as you have health insurance or a social security number, there are no costs. The labs that we're working with have all agreed that even if your insurance denies the claim, the lab will take care of the cost. They will not come back and bill you for it.
Can other family members, like grandparents, be tested?
I'll take that one. At this point, the guidance that we have by the fact that we are using an outside organization to do the testing, it is specific to the students as well as the staff who attend the Valley Stream 30 School District. So grandma and grandpa would not be eligible to be tested, but we encourage them to be tested by either their own physicians or healthcare providers in the community.
My child is on full remote. Can she be tested?
According to the guidance that we have, it is only our hybrid students, so it's our in-person students as well as our in-person staff that at this time will be tested.
Okay. Our next question is, my child is highly allergic to vaccinations. Should he participate?
Okay, this is a good question because this usually gets confused. This situation is not about vaccination at the moment. We are not promoting vaccinations in our schools at this point. We are promoting testing, which is very different from vaccinations. As demonstrated here this evening, it is a swab. No one is being vaccinated, and I would encourage parents, if their children do have allergies or issues with vaccination, that they should really consult with their physicians. But at this time, we are only doing the swabbing to test to see whether or not a child or staff member is positive with coronavirus.
Are the testers bilingual?
We have like one or two that are. It's hard to know. I couldn't promise that because we're doing so many schools at once. I couldn't say who is available on which date. So if you need somebody bilingual, I would suggest having somebody on staff to facilitate that.
And I think at this point, I don't think there's any school that could not facilitate that in terms of our planning to have support for those families that need translation.
Absolutely. Those are all of our questions that are in right now. I'm just going to post up our email address once again so that if our families at home have any additional questions, they can send them over to our email address. It is COVID testing@vs30.org. So please send over any questions. We can post them in the chat and our panel here can answer them for you this evening.
I have a question, if I may. How long does it usually take to get the results, and how is the school notified?
So results typically take 1 to 3 days. We do have a rush on schools. We try to make sure that we get them back quickly. Obviously, you know, there's a lot of people counting on those numbers. And the school will have access to an online secure portal that they will be able to log into. We actually don't even have access to it, you know, due to HIPAA concerns. Strictly the school will have access to it. Also, just speaking to that, we do not keep any information at all. Anything that's written on that requisition form that the parents fill out, that paper goes directly into the bag with the specimen to the lab so that they can bill it. So ATC Healthcare does not keep any confidential information at all. It all goes either to the lab or straight back to the school.
Any other thoughts as it relates to the process amongst our panelists?
I would just say last week a link was shared with families to fill out if you would be interested in having your child tested. So even though we have not been deemed a yellow or orange zone at this time, we are just trying to collect that data to be proactive so we know which students and staff would be interested in participating should we need to gain that 20% of staff and students.
Families should know that if we get the 20% and we are below the positivity rate of the community, the school is, then we would no longer be required to test and we would continue to move forward. So for those of you who might hear rumor that once you're designated a particular zone, the schools are to be shut down, that is not the case. Schools are to remain open and testing is supposed to take place.
We have a question that just came in. How long before the testing will the parents be notified of the testing date? So if they wish to be there with their child, they can.
So what will happen is once we are identified a particular zone, communication would go out very quickly to the families to identify the dates, times, and place for the testing to take place. We have 2 weeks to actually get the testing done for 20% of our staff and students. Anything else? Okay. Well, at this point, if there are no other questions coming into the chat room, I'm going to ask our community to please consider at least letting us know if you are at least considering and would be willing to voluntarily participate. This will just help us to be able to roll out the plan quicker and to be efficient in terms of the work that is ahead of us. If there are any further questions or any other questions that come up after this meeting, please do not hesitate in contacting any of our principals at our schools or myself so that we can make sure that all of you are well aware and informed about what is to come. So I'd just like to say thank you this evening to Ms. Weiner for all of your support and collaboration that you have given to our school district thus far.
My pleasure. I hope you never need our services.
I hope so too. But I think it's just important that everyone is aware of what is to come. I do also want to stress the point that the governor has made it very clear that schools are very safe at this particular point in time comparatively to what's going on in the larger community and throughout the state. The testing is not being done because schools are not safe. It's just the opposite. We want to keep our schools safe. So part of the protocol that's being instituted through the New York State Cluster Action Initiative is obviously to be proactive and to make sure that we are monitoring positivity rates in various areas of our community. So thank you again, everyone, this evening for joining us. Just as a programming note, at 8 o'clock this evening, we will be having our business meeting for the month of December, and we will be having our second budgetary presentation specifically in the area of technology. So thank you all again for joining us, and good night.